name is Vinny Singhal. I'm the co-founder and CEO of CareMessage, which is a nonprofit health technology company focused on improving health outcomes for underserved populations through strategic partnerships with community health centers and safety net healthcare providers across the country. 3 years ago, we were fortunate to partner with Greenlight Fund, and it's been an amazing experience and productive relationship that has now resulted in a number of meaningful collaborations that we've been able to develop with more than a dozen community health centers across the greater Boston area, reaching now over 100,000 patients. What's most exciting to me about this, as it relates to the work that a lot of you are doing, is we're really focused on the things that health centers and community-based healthcare providers in Boston and Massachusetts care about. This shift that's happening from volume to value. And our focus as an organization is really to be one of the many different tools that you can use in the arsenal of tools that you have at your disposal to be able to address this very difficult and seemingly kind of endless problem of patient engagement, and how do you get patients to do the right thing, do the things that they're supposed to do. This problem is something that I saw personally in my preclinical training when I was working in free medical clinics, and I specifically structured CareMessage. We specifically structured CareMessage as a nonprofit in order to be able to serve all segments of the healthcare ecosystem that touch the Medicaid uninsured population, while also understanding that in order for a technology like this to work really well, it has to be integrated with the solutions, with the medical record systems that organizations that are touching this population and working with this population regularly use. And to that end, I was extremely excited to be able to, we were extremely excited to be able to have many Boston health centers be our first adopters or early adopters of our Ocean Epic integration, which we launched this time last year. And now we have several Boston health centers on board. And now I'm incredibly proud to announce that just last week, we signed a collaboration with Azara Healthcare. Jeff, their CEO, is here, that will also make CareMessage available through Azara. And the whole point of all of this is to be able to enable health centers to be able to be more effective at connecting with patients, delivering information at the right time, automating things that can be automated, and ultimately solving multiple problems that deal with this notion of patient engagement, appointment attendance, engagement with quality scores, quality measures, health outcomes that are directly tied to those, and then other problems that we're tackling as an organization, such as referral management and being able to think about how do you close the loop around those things with messaging. So that's our focus. We're incredibly excited to be here and have this amazing conversation facilitated by Mass League and some of our great customers here in Boston, Lynn Community Health Center in Charles River. And I want to thank everybody for coming and just introduce Susan Dargan-Hart, who is the VP of Clinical Affairs at Mass League. Thank you.
Thank you. So yes, very warm welcome to everybody. As Vineet said, I'm Susan Dargan-Hart, Vice President of Clinical Health Affairs here at Mass League. So what I was thinking we'd do, I mean, we're somewhat of a small group. I thought we could do a quick, at the League, we're all about networking and putting you guys together, right? It's all about peer networking, and that's how we really do what we do and do it well. So we do a quick go around of names, role, and health center. That way when you guys talk, you can connect to each other. And then I will, and it will turn back to me, I will sort of launch right into the panel. So we'll have the panelists hold off on introducing themselves, because they're going to do a little more of a, give you a little more information. So I'll
starting here.
Yeah.
Brian Deal, Associate Director of Behavioral Health at the Duffy Health Center, INS Mass, Cape Cod.
Alex Baptiste, Chief Nursing Officer at Family Health Center in Worcester.
Julie Jones, Director of Patient Finance at Boston Health and Homes Program.
Brian Blake, Intern Chief Operating Officer for Fenway Health.
Barb Prophet, Director of Quality Improvement here at the Mass League.
Janice Brathwaite, Director of Workforce Programs for League.
Mel Benson, CFO for Rockland Neighborhood Health Center.
Mary Ellen McIntyre, Vice President of Technical Assistance at the Mass League. Jessica Day, growth at CareMessage.
Karen O'Toole, VP of Public Affairs, Mass Lead.
Siobhan, CMO, Greater New Bedford Community Health Center.
I'm Blair Lanham. I am with CareMessage and work with the health centers in Massachusetts.
Hi, Mark Josephson, Director of Health Informatics here at the League.
Dan McGuire, Director of Population Health at Providence Community Health Centers.
Becky Williams, Director of Case Management at the Lowell Community Health Center.
Liz Sanchez, Director of Policy and Health Access at Mass Lead.
Marlena Brew, Coordinator, Health Informatics here at the Mass League.
Cheryl Shaughnessy, VP of Member Services at the League.
I'm Danielle Funk, I'm the Manager of Health Informatics at Family Health.
Hi, Jeff Brandeis. I'm the President and CEO of Azara Health.
Melissa Renner, Green Lifeline.
Leslie Carver, Boston HealthNet.
Mary Ellen Sheen, Operations at Uplands Clinical Center.
Janice, Dental Director at Charles River Community Health. I think I took your name tag.
I'm just like, I'm not this person. Director of Workforce Programs.
My fault.
Oh, yeah, James.
Sunny Chavan, you spent all the good center.
Yes.
Wesley Clark, Clinical Analyst at Care Health Center.
And you're welcome to take a seat up here if you would like. I see that too.
Okay. Thank you.
All right. So before I introduce the panel, I think just grounding us in what we all know is we are 19 months, I think, into this, amazing and experimental process of the 1115 waiver and what this means in terms of increased value and health outcomes and decrease, cost. And in terms of outreach and engagement, what I see, I think what we all see is some of the highlights of what we are, where we are. And we're in the trials and tribulations, some things that are working well, some things aren't working as well. We have our community partners we have to connect with, which sometimes for some of the health centers is an easy fit, and for others it's a bit bumpier depending on your geography, depending on your history, relationship, etc. And when I think about outreach engagement, I'm a social worker, so I can't help it, what are we offering? What do we have what folks want? What are we offering? This is the first thing I think about with engagement. The second thing is, how are we engaging, and are we consistently engaging? And certainly CareMessage is one of those tools, right, amongst many, and some of it's the relationship. What's our relational way we connect both in person and through technology? And third is tracking. How do we track our engagement? How do we make sense of our engagement? And how do we overall, at the end of the day, really increase people's dignity and quality of life? And we know the folks we work with typically have very complex lives, right? Very complex lives. So how do we help sort of touch and help sort of help to, I don't want to say unravel because that's not the right word, but sort of help get in there and help folks, manage their health a little differently. So we are very excited to have our three panelists to help us sort of, launch our conversation around this. And if you guys would give your name, role, health center, your patient population size, and your EMR. We have George Lazary, Director of Patient Access Support Services from Lynn. Carmen Santana, on the other side, we're sort of, exactly, we're sandwiching Francisca. Patient Access Supervisor, Lynn Community Health Center. And Francisca Guevara, Associate Director of Community Support Services at Charles River. So why don't we start here? And I already introduced you a little bit, but why don't you just talk about your health center for a moment?
Sure. Morning, everyone. My name is George Lazary, and I'm the Patient Access Support Services Director in the Lynn Community Health Center. I've been with the health center for the past almost 4 years, and in this current role in about 1.5 years. We do serve a large number of patients. It's about 41,000 that we have, and a good percentage of that is also part of the ACO, part of the C3, our ACO. And as far as a platform, we use Ocean, which I believe all of you know as a platform for EHR. And we also have quite an extensive use of Azara drives in terms of generating and measuring quality reports and performance measures. So I'm happy to be here, and we'll probably talk more in detail about stuff.
Good morning, Francisca Guevara, Associate Director of Community Support Services at the Charles River Community Health. We
have one location in Brighton and we have another location in Waltham. We serve about 15,000 patients at the health center between both locations. Most of our the population that we serve is mostly Spanish, and the second one is Portuguese, and then all the rest. We use NextGen, and I have been working with CareMessage for the last 6 months, and I'll be happy to share my experience there.
Hi everyone, Carmen Santana. An update, I'm actually the Access Manager, officially starting Friday at Lincoln Health Center. And I work, George is my director, and he already updated the patients and the EMR that we use. One thing that I wanted to bring up was the amount of total appointment reminders we have, CareMessage has helped us with. Right now, as of this morning, has been over 218,000 messages gone out since we started. And that's based off our 41 roughly patients.
Thank you. So, Francisco, why don't we start with you? We'll do a little mix of jumping around here. How are you communicating with your patients in the ACO? I'm going to double up a little bit. How are you communicating with your patients in the ACO environment? And what are you doing in your ACO to get folks to show up and engage hard-to-reach patients? We'll jump to
Yeah,
that.
so we're also part of the C3, and then so most of my work has been using CareMessage for reminder for patients to show up to their appointments. Non-show is always has been a challenge for the health center, so we're trying to break the barriers. And then so we identify that even though patients may not have a computer at home, they were all on their cell phones when they are in the waiting area. So we saw that as an opportunity to send messages. Also, when they are low literacy and they might come to the health center and actually show their phone. When we ask, you have an appointment, then just hand the phone to us, and then we can see that they actually have an appointment. They have all that information there. We also I have been using CareMessage to outreach to our attributed patient for C3. Unfortunately, it has very, very difficult to outreach to some of those patients. We need to figure out why they are not coming to the health center. The part that has been difficult for me is because most of the time we don't have a phone number. We have an address, we have a masculine ID, but we don't have a phone number. So I've been using, doing a lot of detective work from Asara, from whatever is possible to be able to get a phone number, to be able to include it in our CareMessage. So something that I forgot to tell you that I oversee 3 different departments at the health center. So I oversee customer service, health benefits to provide access for patients to health coverage, and I also oversee community health for community health workers. And then so I have been trying and using CareMessages and using different strategies. So in terms of community health, so they were planning to do, since we provide a lot of cooking classes, nutrition classes, physical activity, to use CareMessage to remind patients that the next class is coming, because it has been challenging over the phone. Sometimes they don't pick up the phone, and then we start the phone tag, they call us back, then we call them back, and then so to avoid that, letting them know that the next class is coming up. In terms of health benefits, we are using actually started like 2 weeks ago, for the redetermination for C3. So when open enrollment comes, then we're going to send a message letting them know that it's time to come and re-enroll. So we hope that will eliminate a lot of the phone calls, us going out and then calling us back trying to book an appointment. In terms of customer service, it has been the reminder calls for appointments. And then we have a long list of projects that we would like to continue doing with CareMessage. We really wanted to test it and see how it works for patients, but so far it's so good. We have a few glitches, but they were really wonderful, follow-up and fixing and figuring things out. So I think this is something that I will definitely try to continue using in order to continue engaging our patients.
Terrific. Thank you. Carmen, do you want to talk about, and then George, maybe we can follow up? Yes, we'll sort of tag team.
We can put it out of the way. Sure.
All right, there we go.
She hasn't even started
So basically in the ACO environment and overall like the general effort that we do to reach our patients, it's becoming a little different based on the different care models that get applied and they're needed. So in terms of being more reactive, we have to be more proactive. And how do we identify based on the needs who would be the patients that we need to reach out first rather than the overall picture. So in that respect, we have created several groups for the complex care management. We have a coding team to identify patients with the coding gaps that we have. And we have also created, we do some population health management, meaning that we try and identify patients through the care gaps or using health maintenance features in order to identify patients who are overdue for certain tests. And recently probably the main effort had been usually through telephone outreach, making calls, assigning people to do it randomly. We've tried mailings, not always very successful because probably at least, let's say 50% or even more of the letters tend to come back. Not necessarily the wrong address, but it's because of the way things are set up. Not every letter makes it to the patient. And we've been trying to implement some, again, outreach and home visits. And another feature that has been coming in a little handy is the monitoring of the upcoming visits too, which in the C3 probably modules will fall under previsit planning. I think it's still a little too early for us to say that we have developed that, but that's also a good feature for us to identify patients coming, what their needs are, and how we can get them. As far as the effort to use then the systems available, Carmen is in charge of the contact center and the calls we get and the systems we use, in particular case CareMessage, so I just want to take the glory away from her in talking more about how they're using. We're still in the initial stages of CareMessage, however, we see a lot of potential and she has more to say.
Yeah, so kind of just adding to the process of telephone targeting outreach, the mail, home visits, upcoming visit monitoring. We found ourselves reaching out a lot to the patients, but we did have issues with our phone lines. We had issues where patients couldn't reach us. So even if we called them to say, hey, listen, you need to come to your visit, we found ourselves having these patients hold for a long time, being transferred to the wrong person, hanging up because they waited too long. So with that process, we actually created a team, and we called it the Access Project team. We went ahead and did the lean thinking. I'm sorry, I'm getting nervous. Because we wanted to go ahead and get an idea of the ripple effect that was happening with these patients calling in. We went ahead and kind of broke it down into little pieces, and we targeted the nurses line, for example. A lot of patients are calling in. They want to get triaged on the phone. Sometimes they don't want to come in. Do I need to come in? Can I just talk to the nurse and she tells me what I need to do? Same thing with refills and so on and so forth. So based off this project, we realized that only 29% of the calls were appropriate for the nurses. So we had them, so other nurses were doing things that they shouldn't be doing, on hold to transfer to another department, trying to figure out, how to answer the question in regards to a referral or a future appointment. So with that, we kind of did a lot of PDCA cycles, short-term experiments, and as of 2 weeks ago, we started this back in May, and as of 2 weeks ago, we have reached 100% of nurse-appropriate calls. So this actually helps the patients a lot, just because they want to reach us and they want to talk to the nurse and they want to just one-stop shop, just call resolution that first time. So those are similar things that we're doing to kind of help the access for all patients, specifically ACO, but overall just the health center.
And how was the project engagement team that helped change that number?
Yeah. I'm just going to add on quick. We have embraced or in the path of the lean methodology in healthcare. And we've had changes also in leadership, and now we have a lot of support in embracing this methodology. And with that said, is that we're also changing the way we approach almost everything. So basically, we've been using a lot of tools helpful to identify the issues without jumping right away into resolving problems or putting patches to the system. So they do take a little longer in terms of we really focus on identifying the current issues and really going deeper and deeper in those until we understand the root of the problem. And then by using these short experiments, or the PDCA cycles that we call them, it's good because then you do one little improvement at a time, and if it fails, it still doesn't hit or damage the big picture, the whole effort. So, and as we go through the process now, we also identify tools that will be very helpful in terms of making them adding to the success of what we're doing. And that's what. So that's an area that and Carmen can probably add about the CareMessage effort and what we're doing.
Can I ask if you have a call center?
We do. I have a call center. It's at the main site. We have roughly right now 7 staff members, and we receive anywhere from 1,500 to 2,600 calls a week. I'm sorry, I was just going to say it's 7 members, and then there's also two nurses. That's what we've been trying to do, to make it worth it for the nursing time and for the patients as well, to create that direct connection.
So I understand you implemented simple solutions, just like one at a time. What was the ultimate thing that helped get your patient-appropriate calls to the nurses? Like, how did it go from 29% to 100%?
So first of all, we needed the buy-in. The team is based off not only the executive teams, but we have providers on there. We have one of the nurses from the call center. We have 2 representatives from the call center. You know, it makes sense to bring them to the table. They're the ones that do the job day in and day out. They understand the difficulty of the calls. So it was an overall decision to go ahead and tackle this. We ran the numbers and we saw what was happening to get the feedback from the nurses. They said, well, instead of me having this call that's meant for referrals, I could have been assessing another patient. We do have a system where we can actually instant message anyone in the health center. So our call center staff, they would message, let's say we are color-coded teams, so they can say they're messaging the blue team nurse because our nurses are on the line. Once they're done with that phone, what they do is they go into that peer cloud system and go ahead and tackle that, reach out to the patients, let the nurses on the teams have the ability to kind of address the patients on the teams. So things like that, we kind of
It was more specific. So, do you have a phone tree? And so, were the patients selecting a prompt to get to the nurses?
Yes.
And then did you end up changing the phone tree?
Yeah, we changed the phone tree about 6-7 times. About 7 times, exactly. Since May, we did the PDCAs every time. We kind of switched things around. So we did 7 different phone trees, which was a lot of fun because I had to go in and record them all the time, right? So, but no, originally that was a main concern because the nurse line was number 1. So patients would go in and they felt that they were going trigger happy and just pressing 1 because they know it would go directly to a nurse and they wouldn't have to wait on a queue, right? So we kind of changed it around to the point where now our call center staff actually filtered the calls. So they're the ones that will determine, is this something that I can handle and just book an appointment, or should I get the nurse on the line? Yeah.
Just knowing a little bit about Lynn and the lean process, I know that's been transformative for you guys. I think what's really interesting and really pointing out is how to effectively use quality improvement, workflow improvement in all space of the health center, not just the clinical space, but to really adopt, this is how the culture change, the sort of, using IHI's terms a little and the lean terms, but sort of the spread is with everything we do. But at the same time, and I think you guys really talked about this effectively, is sort of that teaspoon approach. It's You know, that small project, rapid cycle change, small project, and then learn, change 7 times, you know.
Yes, yes.
You know, learn from the mistakes, right? More than the successes, and keep going. That's really fascinating, and we want to hear more as we go too, and we would love audience participation as we go. So, and do you feel that all three of you, do you feel like you've talked about the platform you're using, or do you have more to say? Scott or Carmen and George, do you have more to say about the platform you're using? You talked about phone, text messaging, in person.
Yeah, so go ahead. Go ahead. No, so pretty much, yeah. So it's still that human effect of the telephone, the home visits, the upcoming visit monitoring, and you know, CareMessage is not just for the ACO patients, but for overall. Yeah, so we're using that, and we are also using MyChart as a way of outreaching to patients and patients reaching us as well.
Yeah, for also, you know, I think it replaced the community health workers, that one touch, and also because CareMessage right now is just in English and Spanish, so it's not really reaching out to everybody, but they will come and say, what did this message say, or why am I receiving this text message? So, and also we are using it also for the reminder for all the patients at the health center.
Can I just ask a quick question? Since I do customer service, I'm always concerned about, you know, what is the impact that the customer's feedback that the customer's giving you, number one, and you know, as far as when you implemented this system, what kind of education was done for the patients, so when they got a text message, they didn't say, "What is this?" So I'm just curious.
Yeah, that's something that we really didn't do, and that's when we're trying to have posters around the health center to let them know that this is new to us. And then, but they have received it really, really well, because they have the option to opt out if they don't want to receive message. They are actually really happy. Also because every time we book an appointment, instantly they get a message saying that their appointment was booked. So rather than they calling and say, you know, I don't remember when my appointment was, or did you actually book the appointment? They actually receive a text message, and also they receive another one 2 days before to remind them of the appointment. For customer service, you know, in terms of, you know, if the patient doesn't bring the card that we give them as a reminder, or the form that we print, they can bring the phone. Something that was interesting, I was the customer service desk the other day, and then so the patient give us the day of birth. But you know, some countries it's like the month of first and the year, so we couldn't find the patient. And then it said, no, you don't have an appointment. She said, yes, I do. I said, no, you don't, because we also were trying to type the last name, but you have to like get it right. No. And then she takes the phone, and I said, yes, I do. And then we were able to search by phone number. Because it seemed like the person who registered the patient, they put the day of, because there are some names that are really complicated when you take it over the phone. You know, especially if your first language is not English, it's like it was I or E or O. Okay, so and she said, and then so with the phone, we said, oh, that's the number. So we typed the number, and there was the appointment, and like you're all set, and then we were able to fix the name and the day of birth, and everything was smooth. So in terms of customer service, I will say that that's the thing. Able to communicate a little bit more, not really using like language.
You know, I think you bring up an incredibly important point, which is, you know, the customer service aspect at all levels, and also understanding your role in its entirety. That we're the ones who have to slow down. We're the ones who have to ask different questions, and it's hard when you're in a call center environment. You know, when it's, you know, everything's amped up.
Another thing that's been positive is that the patients say, you didn't remind me about my appointment. That's why I didn't come, because we say, you know, you have missed your appointment 3 times. Is there anything I can do? You want to come in the evening, in the morning? Like, why is it that you couldn't keep your appointment? And they said, well, I didn't keep my appointment because you guys don't remind me anymore. And then so we can go into CareMessage. They said, well, actually, yes. And you said you were coming. So here it is, because it says, do you want to keep this appointment? He said, yes or no. I said, well, you said that you were coming. So your appointment is there. And I'm, oh, okay. So it's kind of like, now you're keeping an eye on me. But so in terms of that, you know, that before we didn't have a way to kind of document this, and now we do. And then, so for example, if a nurse say, you know, this patient didn't come, but didn't receive a reminder call, we can just log in and check, and then do a screenshot and send and say we actually did, because here the patient said that yes, they were coming. So it serves a communication and documentation that we actually doing what we're supposed to for most of the time. Yeah.
So for the Community Health Center, we had an option prior to where you can sign up for a text message. It wasn't something everyone chose to do, but when we launched CareMessage, we just sent out a message to everyone in our Epic system, just letting them know this was going to be the preferred method. One thing that we really like with CareMessage is that the system is smart enough to know what's a landline versus what's a cell phone number. So it'll know that I'm going to send a text message as a mobile number versus this is a landline, let me call and leave a message. And kind of the same thing, that we are able to go ahead and pull the information and look at it right away that, you know, this person did confirm, this person didn't. One challenge that we do have is just trying to engage patients more to go ahead and write yes or no that they're going to come. Because some of them, they just look at it, they don't respond, but it's up to us to kind of
Sometimes
engage
they
them.
give thumbs up.
Yes.
I just get that message.
Yes, we get the smiley faces.
Oh, I love
Yeah.
that.
Yeah.
That's great.
Thank you so much. I almost forgot. Like, it's just they think they're talking so loud.
That's great. I love it. Yeah. So, I mean, you all three really talked about this, but I'm going to throw it out there anyway, sort of a two-parter. You've started to talk about over time how your approach has changed. So, you know, adding to that, you know, you certainly can elaborate a little bit more about how your approach has changed, and what's sort of the next thing for you in terms of the change you might, you know, tomorrow. What does tomorrow look like for you?
I mean,
so I mean, communication has changed in the sense that, like kind of what she was saying earlier, it's all electronic now. It's all on your cell phone. One thing that we're kind of pushing towards in regards to CareMessage helping us at one point, which I hope we kind of pick this up again, is that we were having issues with patients in regards to referrals, keeping their referrals, knowing that they need to take, you know, this liquid, they can't drink liquid within 12 hours, et cetera, et cetera. So through CareMessage, there's actually a way that you can actually message the patient directly and say, hey, listen, you have an appointment, Salem Hospital this time, remember, no liquids, you know, 12 hours before, and things like that. So that has changed in regards to, if you call a patient, they'll say, oh, hold on, let me write that down, hold on, wait. They can't find the paper, they don't remember what you told them 10 hours instead of 12. Versus now it's on their phone and they can go ahead and just follow the directions. And hopefully we're gonna continue with that, and we have, you know, outreaches for physicals, for mammograms, for the flu clinic coming up, so we're gonna start using it for all those communications,
Yeah, for Charles River, we're actually gonna try to use it more for dental, the medical recalls. So when providers do the recall for 6 months or 3 months, so instead of sending a letter saying, as Lynn, you know, we send thousands and thousands, and then half of those come back, and then we have to come and enter into the system saying that we sent, but they came back. So it does require a lot of extra work. So we're trying to use to implement CareMessage for the recall for medical and dental, and also so because we will have the documentation that we try to reach to them. Also, I had an appointment yesterday with the vision operations. So we're trying to figure out how to inform patients that their glasses are ready, because again, the phone tag is endless. They try to call us, they will try to call them, they will try to call us, they will try to call them. It's like 4 or 5 phone calls. And then just to let them know that the glasses are ready, so we're going to send a message letting them know your glasses are ready to pick up, and you can come between this day and this day at these hours, and then somebody will be here for you. And that was, I think that would be a relief for customer service, also for everybody basically, right? Because and what else we're trying to do? And also, like for example, is October is Breast Cancer Awareness Month. And then so we would like to send like health messages to patients, like you remember, for women, remember to have your annual mammogram, and we also have a grant for cervical and cancer prevention, so we want to use that for reminders to keep themselves healthy. So I think the possibilities are endless. It's just we don't have enough time because we're doing like 100 other things when we're doing CareMessage. But because if we see that it's very positive and it's actually, allowing us the time to do other things because everything goes into CareMessage, we'll definitely, we'll continue using it for a lot of different projects that we have at Health Center because communication is key. Also, the winter is coming, if we need to close the health center due to a snowstorm or anything, then we will be able to send a message letting them know if we're opening or not opening. So, rather the patient driving in and see the big sign on the door and then go back and get frustrated and upset enough, we really wanted to use CareMessage as communication for everybody. If they opt in, they opt out, that's a problem. But so for C3, for example, I don't know how it happened, but we were trying to reach out to a patient to come to the health center and book an appointment for C3, and then she replied and said, I actually had not lived in Massachusetts for 3 years. How did she have myself? I don't know. But at least I was able to go and delete that patient and then send a message to myself and so they could figure it out. But that, because my job is to keep sending message to all the C3. It doesn't matter, every month until you do what you're supposed to do, either come and book an appointment or disenroll or talk to my health and go to another health center or, but that was really useful, so I can go and delete so that person will receive a message and they're able to write to us, like, why are you sending me a message? I don't know who you are. And I'm like, yes, you need to get to know us. But so those are the different projects that we have been doing.
Can I ask a question? So when you get, like the 218,000 text messages that have gone out, I'm sure you didn't get 218,000 responses, but who sorts through the responses? Do they come into a central place and any of y'all can go through, like how do you do that?
So that lives primarily in CareMessage. You're able to go in and kind of distinguish. You can go from providers, you can check by date, time, you can check by the groups. Type of business groups, pretty much it's all there. It's very user friendly. You go in and you just enter what you're looking for. If you wanna, kind of for example, the example that she gave with the snowstorm, we were talking about that earlier at the beginning of the year when we first went live. We had a snowstorm. I had to go in and kind of pull that data from all those patients that were scheduled from 8 to 12 o'clock and send them a message saying due to the snowstorm we're gonna be, we're gonna open at 1 o'clock. We'll reach out to you once we're open to reschedule your appointment.
Is the way you can easily, rather than typing in all kinds of numbers, you can just like click or pick the list and just send a message?
They do have available scripts that you can use.
Got it.
Yeah. Right now we have a monthly health. I think it's the first Thursday of every month. We send a text message. There's a text message that's sent out with a healthy tip to patients. So that's one way we're trying to engage patients to kind of just get used to receiving these messages.
And then can I ask, sorry, part two. My understanding is that some patients have limited minutes, and like the beginning of the month, they use their minutes, and then they keep doing it. So text message limits, I would imagine not as much of a challenge. Do people have limits on text messages as much?
We get a separate list that's sent by CareMessage, I believe once a week, where we get a list of non-responding patients, like patients that they tried to outreach but they got a message back. And then we can go in and kind of take a look and see what is going on.
Okay, so
yeah.
Oh, that's cool.
So you're able to do that, yeah.
Have you had any feedback from clients? You guys are messaging too much?
At the beginning, yes, but it was kind of like a glitch, just kind of the intro of, hey, CareMessage, Lynn Community Health Center, and then just, they got a few at the beginning, but some have, one thing that we noticed in uptick is that patients that wrote stop are now complaining that they're not getting reminders. So then we just tell staff, just let them know that we'll look into it, and then it's just they opted out like 2 months ago. So we go ahead and just turn it back on, but it all depends. Some people don't care for it and then they do, and some people do. It's just up and
Well,
down.
actually, at the time of registration, we asked them if they would like to receive text messages or phone calls. And they will tell us, you know. And most of them like, oh, message, that's great, yes, please. Yeah, so we asked them at the time of registration.
So, it sounds like there's lots of, like, kind of sky's the limit on messaging, but how do you decide what are the right messages to send and when? Because the other thing that can happen, right, is kind of like alert fatigue. So I get so many text messages, I'm not really noticing the ones that are important. So how do you kind of decide which messages to send and when? Because if every department had their choice, people could get messages all day, every day.
Yeah, so for the Community Health Center, not everyone has that choice.
Oh, okay.
Specifically right now, it would be just medical. BH, we're still kind of struggling with just because a lot of patients don't want no communications at all. So that's more on a manual basis. Vision is the another department that has been doing weekly recalls, just saying it's time for your vision check. They do from 80 to 100 a week, which has cut down on manual labor, which is before we used to have to go in, oh, you're due, let me print out a letter, let me put it in the envelope, let me ship it out, oh, I got it back 2 weeks later because it can't get delivered. So instead of that, it's just an instant message for that. But I wouldn't be able to say too much more about that just because the way it's set up with us, it's she's saying you instantly get a text message. You book it right now while I'm still with you on the phone or while I'm still with you registering, you get the message right there. You get it 3 days before and then the day before. Some patients who say this is too many, we just explain to them, listen, this is to help you so you can make sure that you remember to come in for you and your kids, because sometimes, you know, mom would be, you know, the main person and she'll have 2 or 3 children, and it's like, that can get a little bit overwhelming, but we just tell them it's beneficial for you because you know when you need to be here. So we try to kind of discuss that a little bit with them.
Can you adjust the amount of messages?
It's capped at 163.
But if I say I only want to know my appointment, don't give me a reminder on due for glasses or Thursday.
I know the vision department, they customize theirs. It's very simple and straight to it. Yeah, it is flexible. Yeah. We just use the manual, just blue team, such day, such time.
But I'm just going to add Leslie's question. The other thing is that with Ocean, with Epic, CareMessage is a bit bi-directional system. So when appointments are confirmed, we also see it as it shows in Epic. And as far as customizing messages, is that, I mean, with the changes in healthcare and how to take care of the patients, we're also developing what we call the measurable self-management goals for the patients. And in that case, reporting comes in very handy to identify groups of patients who are in need of their diabetes check or hypertension or anything. So we do use develop reporting through drives, and once we get those and identify the groups, the plan is now, it's not happening yet, but the plan is to reach out to these patients with messages like, it's time for your A1C check, or did you follow up on the on your high blood pressure or anything like that. So that's going to be accurate reporting teamed up with customizing CareMessage and then doing the outreach. So it will free up more time on our end, would be definitely more customized and targeted as an outreach. And I'm confident that it will absolutely help the patients in improving their lifestyle too, and also culturally how to take care of themselves, so to shape the culture in preventive versus going without use of it.
So, oh, sorry.
I had a couple of things. One is probably the CareMessage team. One of the things that we ask patients to do is like, well, put it on your calendar or on your whatever, you know, the refrigerator or something. Is there a link between CareMessage and the calendar on the phone? So it pops in, and one of the things that we think some of my patients struggle with is, you know, we are sending them messages, but they have 3 different referrals outside the health center, and then they're getting messages.
Yeah.
And one of the biggest challenges making an appointment is it doesn't clash with another appointment that they may have or not have. And, just the appointment, not even their other life place, and that is one of the reasons why they miss their appointments, because they're juggling with so many things. But is there any sort of work around that? And I think the second part was back to the teams. Anytime you see new technology, we all get excited, and after a while, it plateaus off. So is there a consistent improvement in the no-show rates with the change in the system beyond like the first bump that you see, that things have improved, and then it just kind of goes back to how, we were all excited with emails and portals and stuff like that. So maybe 2 separate questions. Thank you.
I'll get on the second part, on the second question, but, so the no-show rates, there is some slight improvement noticed, honestly. We've been hovering at, in the past, maybe 25%, and it seems that now it's 20, sometimes a little bit over 20, depending on the team, but on average, there is improvement noticed.
Can you remind us how long you've had CareMessage?
We've had it for, I'd say, less than a year now.
Just thinking
Less than
about
a
it.
year.
About 6 months.
6 months, okay.
Yeah.
So
So it's
relatively
pretty
new,
new.
so
It's
you're-
like, we're still learning. Yeah.
Yeah,
So
it's,
we're still learning.
yeah,
how to use
absolutely.
it.
And Francisca, have you noticed, or have you guys been able to calculate yet a shift in your no-show? Have you looked at that yet?
Well, it varies every month for different circumstances, so we don't really know. It has been similar throughout the month, so we have not been able
Haven't been able to do
no,
it. I mean, it's
no.
still so
It's
new.
too soon,
Yeah,
yes.
to do real
yes,
analysis.
Yeah.
Yeah, and I think just to answer the question of referrals, it's something that we understand is, I think, a more of a global issue, right? There's referrals being made on a regular basis by health centers, and then there's external kind of appointments that are being scheduled. And the way that we're looking at the problems, right now there's no kind of direct integration with the calendar, but and certainly the scenario you described can be fairly confusing for somebody who's juggling so many different appointments. One of the things we're looking at very intently is this whole notion of how do you close the loop once a referral has been made by a primary care provider. In this case, obviously the health center would fall into that category. And we've observed through conversations with Lynn and many other health centers in Boston, elsewhere in the country, that there's a number of things that happen once a referral is made that make it very difficult to, in a scalable way, understand if a patient actually understands what they're supposed to do, if they have actually done what they're supposed to do, and then what their experience has been with that action or referral. And that gets more and more complicated. That's complicated enough for a single referral. Imagine if there's like multiple, right? And you're juggling kind of different things. And so we're actually building a new product around this problem, trying to hopefully increase, first of all, automate this process that is currently happening through phone calls and different things that are very manual and maybe not as effective, but then hopefully increasing the percentage of closed referrals, closing that loop after referrals are made using messaging as a way to do that. And we actually have several pilot customers, including one in Boston, that are helping us experiment with that and understand what are some of the ways in which we can do that. There's some very interesting issues that come up because some referrals are pretty sensitive in terms of the actual referral itself. So how do you communicate, especially if you have multiple referrals, instructions and different things like that. So there's different things that we're experimenting with. We're also launching a mobile app at the end of the quarter. Sorry, at the end of the year. We're in beta testing right now. That will enable us to test whether a text message plus a encrypted mobile app experience can enable providers to segregate messaging based upon the sensitivity level of the information. Like some information might be better delivered via text message, some information might be better delivered through something that's more secure, right? Because text messaging inherently is not encryptable. So, long story short, like this is a problem that we're acutely aware of through conversations with folks like Lynn and Charles River and others across Boston, across the country. And we look forward to kind of sharing what we learned with you all.
That would be great, actually, because we're really very interested, and I probably speak for everyone how difficult the referral world is out there, for especially for community health centers, that we have to refer everybody outside. It's a different story when you're in an ambulatory clinic within a hospital, because you try and keep things inside. But in this case, we do have a high volume of referrals. We average, I would say, about 150 to 170 per day. And it's a challenge in completing all the steps, realizing at the end that the patient doesn't want to go, or the patient doesn't get the notification on time, or multiple things could happen. So that would be, in my opinion, would be a great move to help facilitate the process and make sure that we schedule that in real time.
It's actually a great segue to the next question, which I think we're already sort of there. And Francisca, we can start with you and then jump to Lynn. What are the tools or strategies your organization has used to improve patient outcomes while also providing a more personalized and customized patient experience? Thinking about, this is all about behavior change, in a lot of ways. It's about patient behavior change, it's about staff behavior change, provider behavior change. So we just sort of started talking about that. Like how do you use technology but also human touch, right? To help, shift the patient experience. Do you feel like there's any, I feel like you've talked about this some. Is there anything else you want to say?
Or as I said, because I oversee the community work as medical interpreters, nothing is gonna take what they bring to the patients, but we definitely need to use technology as a backup because we just keep growing. And then, so for example, something I forgot to say, that we did focus groups before implementing CareMessage. Seniors were not very happy with receiving messages because sometimes they don't own a line, or they have very limited texting, such as the SafeLink phones. So we did a focus group just to have an idea if they were going to be happy with CareMessage, and some said that they would like to receive text messages, and some were like, no, you keep calling me. You can keep sending me the letters because I don't feel comfortable, I don't know how to reply. And then so focus, if something that you want to implement, a focus group would be, I would advise to do that. And also, as Carmen was saying, have a group of staff that is actually be doing this, is the one they're going to be doing the work, because they are really the ones that they're going to tell you what patients are asking for, what they would like to see, what are the challenges, and then so you can just tackle the challenges and varies as they come. I don't know if that answers your question.
No, it totally does. It makes me think of another one, but I'm going to wait for Lynn to jump in here.
So I do have a few examples. Then I have to say 1 second. All right. A few, I can just read off to, we're in the process of further clinical integration with behavioral health in the PCP teams. We do warm handoffs on the PCP teams at our main behavior facility, which is a Rose team. We have integrated medical as well, and then we have an outreach team, which is the RCC, where it's an in-house facility with Bridgewell where patients stay, I believe up to 30 days, George?
Yes.
So we have those type of programs where those patients eventually will integrate to the main site and have a PCP and have the behavioral health all built into one. Another thing is better reporting. We use the RBS Azara to generate reports on quality measures.
I mean, one line of service that we think it's beneficial to the patient understanding better is having a clinical pharmacist in-house, because that helps a lot in patient education in terms of their treatment and outcomes of the treatment, the course of the treatment. So that has been, I think, quite helpful for us. And of course, as Jessica said, we also have a lot of patient engagement in terms of these, like some grants too, like there's a grant that says Moms Do Care, for example. So that's a grant that we have that does involve quite a bit of mothers and young mothers and their engagement with their health and their life, basically. And we do have other groups, I don't know, maybe some cooking or different classes that we have. So those have been all very helpful. But we constantly are working also on our end with the providers and the staff in terms of not only training that for the everyday services that we provide, but also in getting them even more involved in what they do. So I always like to incorporate the cultural factor because I think it's very helpful in understanding the patients and in understanding the way you communicate with the patients and what their expectations would be and how to be culturally more also like open-minded and understanding for everything that the patients represent. So these have been some of them, and I'm sure there's many more. As they come to mind, I can always bring them down.
Do any of you use CareMessage to help address the low acuity ED volume? Is that a population that you targeted?
Not through CareMessage.
No, it's great.
Not yet, we'll do that.
But it does make me wonder, and I was thinking about this before, you guys were all talking about sort of two pieces to that. One is, and I think Francisco, you were saying this, but all of you were saying this, sort of that it does take an investment. I mean, you guys lean, it all takes an investment, and you know, you're all talking about that. But there is that sort of, and I'm going to be cliche for a second, but sort of that return on investment, right? If you invest up front, you get more. And that relates back to, what does it mean when we're in touch with patients, both on a very superficial, this is your glasses are ready, your appointment or whatever, that does two things, right? It engages people who are lonely who go to the ED, but it also engages, you showed up for your appointment so you didn't land in the ED because your insulin is a little more under control. So it'll be interesting over time to see sort of how the data plays out. And now with your relationship with Azara, it'll be a lot easier to sort of over time. And I'm so not, you know, I can't even say technological. So, you know, I'm sort of like making things up as I'm saying it, but it just seems like a positive thing.
They sound good.
Thank you, right? Thank you. I've been hanging out the league for a while. But the potential for bringing these things together, and I know, you think, you know, and Jeff, you think about these things, so bringing them together, and the one thing I was thinking about too was, in my former life, we had the app, we had, and I won't go into it, but the HS app, I don't know if you're familiar with HS, it's an addiction-oriented app that's not available on iTunes. It's more through Samsung. But anyway, and it was many, many, many things, which I won't get into, but addictions clinicians and recovery coaches could interact with their patients through the app, through a secure, and so it just makes me think about all the possibilities and how, in the end, it gets to exactly what you're saying. Reduced ED, but increased health. So very cool.
I just have a quick question. So we talked about pushing messages out. Can patients initiate a message to the teams?
Instead of just responding?
Right.
Through
CareMessage, yeah.
No, they have to reply to the. So we use the portal, patient portal, to communicate. And now we're going to start MedFusion when new patients will be able to book their appointments. Through our website. Yeah, so that's different. So it does take a lot of time, I will not, and also because You know, like for example, for me, everything was over the phone. So we met once in person, and that was great. But then once you said, well, now everything's gonna be on the phone, I was like, oh. But they have been very patient, and sometimes they had to take over my computer because I don't know where to click, and that has been really helpful. Because I was getting anxious at the beginning, it's like we just have 1 hour to send this message out, and you have 800 patients there, and like, oh my goodness, how am I gonna do this? And now go here and go there. No, let's start all over again. It's okay. And then at the end, they are like, let me just take over you. But then at the end, I'm like, I actually did it, and they were like, well, we're so proud of you. Your message has been sent. They were like, oh my goodness, I did it. And yeah, he said, yes, ma'am, you just did it. And I was like, oh, such a. So it takes time. It's not complicated, but it's something new. You have to log in. You need to have a password. You need to go click here, click there, download. What is your? Oh my goodness! Like, but then as we practice, it's actually getting easier and easier. And now I think I'm pretty comfortable on trying to create my verbiage and my patient that I have to send the message and connect them, and then the message stuff. And you're like, oh wow! I just communicated with about 1,000 patients in like about 10-15 minutes, and that's great, you know, rather than printing this letter and then send it and then to the post and then it comes back. It takes about 2 hours, you know, the difference of 2 hours but 15 minutes. Of course, you need to have all the tools, you know, in order to send the message, but you know, I think it is a return on investment, because by the end, you know, 2 hours versus 15 minutes. That is with 45 minutes to call the rest of the one and receive the next message.
So it's just,
yeah,
so just to add to that, so if it's just a reminder for an appointment, they'll write back, but no one's really monitoring, unless it's yes, no, or cancel. But there is a availability in the CareMessage app where if, let's say, if you are a case manager and you have a set of patients that you need to outreach, you kind of communicate via phone, and that's something that together you guys want to do, that's something you can do on it, where you can actually message the patient, they can message you back. And back and forth. So that is available.
All right, just 2 questions. Do you use the messaging to drive patients to your portal? And number 2, does your outgoing messages, are they in the patient's preferred language?
No, so we are not using it because we cannot do just so much at the same time. You know, we're kind of piloting and see the effect that it's having in patients, and then so we can move to the next project. So no, and your second question was, I'm sorry?
Is it in the patient's preferred language, the outgoing message?
Well, we just have it in English and you know, the capacity for CareMessage only English and Spanish we have requested. Like for example, Portuguese will be the third one for us, but right now it's just in English and Spanish. But patients sometimes will come and say, you know, what does it say, or they will call the community health worker, say, I receive a message, what it is. So, you know, it's not perfect yet, but we'll get there.
But that was an interesting question with the connection with the portal, because we would like to use the portal as much as we can. Currently, we have about, I'd say, 25% of the patients who have signed up for the portal. Not necessarily all of them are actually using it, but the ones who use it have now the possibility to also schedule an appointment with restricted only to 1 or 2 types of appointments, so that we don't get misuse of availability of different types of appointments. And but that's something to look into, because currently, if they receive a message on the portal, they will get the message in their email, which they signed up. But that could be something we can look into for them getting a message, a text message saying that you have your lab results are available in the portal, or something like that.
Drive them to
Drive them to
the portal
without needing to check the email.
Yes.
Yeah, so my question was, would there be a language capacity? Can the product be arranged for specific language? For Rockland Neighborhood Health Center, we have majority Cape Verdean, Portuguese, and Asian patient population. So if you can provide us a product design for those languages, and is there any possibility? So does CareMessage has integration with NextGen where provider can message patients directly when we are checking the labs or the test report, and we can just click and send a message, you need to make an appointment? Is that an integration app?
I think, so just to understand the second scenario, the request for, would that be like a recall, or would that be something?
So would that be it could be an integration within the EMR where anyone who has access to EMR can go in and click the button for CareMessage maybe.
Yeah.
From the patient's chart and message the patient directly that you need an appointment to discuss the labs or so that I'm not involving my staff.
Yeah.
Because this is something I can do during my admin time. I'm checking the labs and that needs attention. Instead of diverting that information through my staff and asking them to contact, whether I would be personally able to contact the patient or message the patient directly.
Yeah, what we built for Ocean, which I know Lynn, you guys are not using yet, but were essentially the interventions that we offer. For example, the diabetes intervention, which is a 25-week structured program for newly diagnosed diabetics. They get 3 to 4 messages per week. It's interactive and it gets more personalized as you go. It's almost like a coach that's like communicating with you about your condition, but it's automated. That is something that actually a provider can enroll a patient from within Epic, from within, I believe, forgot the module, it's something within Epic. And it's almost like you're ordering them for a intervention or a lab test. It's something like that, but it's like you're enrolling them into a messaging intervention that they're going to get from within Epic, right? So we could explore something similar with NextGen, although we haven't done that before necessarily. Just to address the language issue, since I know that's come up a couple of times, we really, I think, value and care a lot about user experience, and I think that's extremely important to us. We've seen other similar kind of platforms, I think honestly do a very poor job of caring about user experience. There's a different solution out there that I think they have similar, or try to have similar functionality, and they had on their website, they had a message about asking a pregnant woman if she was going into labor, right? But the word they used in Spanish for labor meant like literal physical labor, like work, trabajo, not actual like labor. So there's different things that, I think from our perspective, that I think when messaging has been developed for this population, particularly individuals that are low literacy, non-English speaking, dealing with a lot of, I think, underlying barriers to health, that I don't think is respectful and authentic. And we try to be very much on the side of, we would rather not offer a language if we don't believe that we can do justice to the nuances, and even in Spanish, thinking about the differences between Mexican Spanish and other types of Spanish that people speak, and using words that are similar across those different variants. So we only offer CareMessage in English and Spanish. You can use CareMessage to send messages in about 35 languages beyond English and Spanish, but that would have to be, I think, done by your staff, translations, etc. The user experience is going to be not as great because it's not optimized for those 35 additional languages. You just can use it to communicate in those languages. So, when we do offer a third language or a fourth language, which we do intend to in the future, I think one thing that you can rest assured is that it's going to have some of those underlying, research and thoughtfulness behind it that hopefully will make it more amenable to rolling out to your population.
Something that I want to add, and I know you guys are asking a lot of questions about how to use it and the providers can use it, but you have to be really careful about confidentiality because phone numbers change very often for our population, so you need to be careful of what type of messages. So just as an appointment reminder, pick up your glasses, that's not a will be a HIPAA violation. But I won't send a message saying, you know, like you have an A1C or so and so come, because you never know who's receiving that message. So I will be very, very careful in how you use CareMessage, because when we check, so something that we're doing now every time that we book an appointment or speak to a patient, we ask them to confirm the four numbers, the four numbers of the phone number, just to make sure that it is still, they still have the number, because unfortunately it changes a lot. You don't want to be sending messages about health-related issues to somebody else. Or also, like, you know, if you don't know if your partner wants you to know that you're going to see a medical provider behavioral health. So I'll be very, very careful. That's what I'm not a big fan of, doing more than what we're doing right now. You know, call to renew your coverage, you have an appointment, you know, and also because there is some sensitive information as well. So for example, we had a medical provider leaving the health center, and you know, what about if we send a message and the provider was like, no, definitely you're not gonna do that. I'm gonna write my letter, I'm gonna sign it, and you're gonna send it us our patients as a respect to them. I don't want them to find out that I'm leaving through a CareMessage, so through a text message. You know, so that's what I say, that you have to be really, really careful and how you use it, and then just go up. Just because we're saving some time, I think we just have to be really, really careful about CareMessage.
Yeah, so I think, and maybe I misheard both ends of it, but it sounded like more individualized outreach through the electronic health record. Is that a feature that's functioning? So as the individual client, if I'm working with a client, I haven't seen that.
Certainly, yeah. I mean, it depends on the interface, and depends on how it's
Right.
built. But the technical capability is certainly 100%.
Can you talk a little bit about the implementation period? You know, like once you decided that, yes, this is what we're going to go with, everything is signed, to when it was really ready to go? Because some of these programs are really exciting, but to get there takes.
Can I just, you're fabulous. I'm like, you know, checks in the mail, because I want to actually shift to operations a little bit. So that but I want to back up for a second, and maybe we will jump to Becky's question, but sort of thinking about, I want to talk a little bit more about operations, right? Because it's all fabulous, and I think you actually started to get into it a little bit. This is a huge culture change, and what is the culture of the health center? How does the culture of the center, you know, work into this? What are the workflows, and people even, you know, sort of training, and so sort of how did you start? What are the ways in which you even just started in talking about this and implementing it? And if we don't hit, then let's circle back.
For CareMessage on my end, I think they started talking about implementing this back in, I want to say maybe November, December of last year. I currently in my role since January, so by the time I came aboard, it was already something they were talking about. I don't have the nitty-gritty of how exactly it kind of was brought to the community health center.
But we did have to create the workbook.
The workbook, yeah.
Which covered every clinic and every service, because you can opt out services altogether. It can be a service on the phone that you get messages, and that was one of the major tasks to create an accurate workbook that covers at least all the providers, the clinical services, and then in terms of like the technical side of things, training was minimal. The transition was flawless because it was done through, I think, CareMessage and Epic working the back end together. So we set a date when we're going to start. The first couple of days, if I'm not mistaken, we had to load up the appointments to make sure that we capture everyone, and then the system really kicked in a matter of days. So,
I think that's when it caused patients to get double reminders, but it's
Yes.
because we rather be safe than sorry. But kind of what George was saying, it's it's manual labor in regards to the workbook. However, you customize it to what it is that you want. What is it that you want, what you don't want. For example, we wanted to make sure that family teams and OBGYN got their appointments versus if someone went to the urgent care and we worked an appointment right then and there, they wouldn't get a message. Same thing with some behavioral health services and HIV testing and all of that. So you can really customize it to
The workbook that you're speaking to is a CareMessage workbook. So you really have to.
Right.
It's like a blueprint for how you're going to do it.
Right.
It's also a detailed explanation of what we give CareMessage for them to implement, basically, in their system. Is also I think we have to list all the types of appointments that we have in different breakdowns of group service.
For me, it was a little bit different. So we also been with CareMessages for about 6 months, and actually was my director who was in charge of all the negotiation and everything. And then basically she said, well, Francisca, you have to log into CareMessage and start sending messages, and then like, okay. So she said, I'm gonna open an account. Yeah, so I'm gonna open an account for you, and then you go in and play with it, and then that's how everything started. Then we identify, so C3 has been a big challenge because we are phone calls, letters, everything. The only thing we need to that we are not doing yet is going to their homes and letting them know that they need to come and book an appointment. So I have done like so much, and then at the end was what about CareMessage, and then so basically she said, well, I'm gonna give you, I'm gonna open the account for you, so you get your username, password, get in touch with them, and good luck. And then so now they think I'm the pro.
Oh yeah. Are you the only one?
No, we have about 3 different. So customer service is managed by the coordinator of the customer service, and then so I have 3 different coordinators for the 3 different departments. So I'm teaching them and how to do it. So they have their specific projects. So I've been very careful in what projects I choose for CareMessages for the reasons that I have given. So dental is actually another one that we would like to implement, a reminder of the dental cleaning that coming up, because those, rather than get in the card and then stamp it and send it, and then we go and then like they're bad. So we're trying to do that. And then so the coordinators now are learning how to do it. They choose their own projects, and I'm just there to guide them. And CareMessage has been great of providing the support, so I feel like now I'm a little more relaxing. And it's very intense. So we had like actually weekly meetings. And then we're like, oh my goodness, it's another Wednesday, I'm not ready.
You and the coordinators.
Me and the
CareMessage. So you and the CareMessage have weekly. So it sounds like in terms of rollout, you sort of, wave a magic wand and
that's
do
how
it.
it happened.
I know. Well, it's a great example of small center versus larger center and what the resources look like and everybody in between, right? So I just want to sort of get really, and then I want to hear from you guys. So you got thrown this, you learned how to do it, and you work with CareMessage pretty closely, and it sounds like you're training your other folks. How have you to do it? And how have you trained the front desk staff, the providers, the nurses, how have you impacted cultural change through training at the center?
Well, so we have staff meetings, and then each department have the responsibility to bring that information to the different departments that we're going to implement CareMessage. The medical providers know that this is happening, but it's really operations who takes over.
So how did they know? How did the medical providers know?
How
the email went out and
No, it was it was part of the agenda of the medical providers that we were going to implement. So for example, they said, this message has to be given to all the staff at the different department meetings, so it's part of the agenda of every department, just to make sure that we had rather than go email, because sometimes people don't read emails. Per diem staff, they don't read emails. So I'm like, oh, when did this happen? So it is important for us to be able to bring the information to them and give them the opportunity to ask questions. And also, so if they see any barriers or challenges, they can bring it to us. Or remember that program that you say, we're going to implement, actually patients are saying this and this. And then, that's how we manage communication.
And so my third question, and then I want to hear from Lynn, is how'd that go? I mean, was there like, oh, this is fantastic, or was there mutiny, or somewhere in between? Like, how'd it go?
No, so we know there was a need because of the phone tag, all the mailing that comes back. So it's frustrating, you know, trying to communicate with patients. So it was just, okay, so we're trying something new. Okay. You know, and then everybody.
It sounds like people are like, oh, thank goodness we're doing something.
Exactly.
So there's relief. Like we're doing something,
because
so the
now
adoption.
you're trying something new rather than being like 20 years back that were mailing and then phone calls and everything. So so they actually really like when we try something new, you know, to reduce the amount of work that they do, and also to eliminate waste. That's how we call it, eliminating waste, printing letters, the labels, the stamps, coming back, then you enter this in the system. So, okay, so we are gonna eliminate. So we do like so we put a sticky so the wall like for customer service. For example, they said, okay, since the time the patient comes in, or when we book the appointment to all the way patients come to registration, right? What from here we can eliminate. You know, that it's not necessary that we can use technology. And then so CareMessage was part of it. And they were like, yes, perfect. Yeah, so we still have to see how, you know, it's working and everything, but I would say that we have had many challenges.
So you had real buy-in pretty quickly.
Yeah, and also the patient, they know that I know of, they have not been complaining about it. Some here and there, but sometimes they complain about it. You know, so like I know, oh yeah.
How about, thank you. How about Lynn? Sort of, you know, how was your adoption, training, and buy-in?
I was gonna say, since Carmen wasn't on board at the very beginning, we did have a few, after it was decided that we're gonna go with CareMessage, we did have been for a few weeks trying to make literally a presentation in every different level of the organization using group meetings that they have, providers meetings or management meetings, and even all staff meetings. And the idea was because in the last, I don't know, maybe the last 4 years, there have been multiple implementations, like Epic was a major one, that of course there's still people who are not used to it. We did change the telephone system. So we went from a landline telephone system to a cloud system. And then there was CareMessage. So for some folks it was that, oh, not another change now, we're not used to the rest of it. But the idea is like presenting and making it very simple in comparing what we have and what the benefits would be. It did create a positive atmosphere and a positive reception on the staff's end. And then from the time we went live, and even before going live, we've had several meetings. I don't know if we had any, you came over a couple of times, I remember you meeting with us. Yes. Yes. And then, and we still continue having weekly meetings, weekly phone calls, troubleshooting or discussing future possibilities. So in that respect, it's been a straightforward and flawless interaction.
Does that get at your question, or do you want to resurface your question?
Yeah, I think so. So it sounds like from the time you decided, there's probably a lot of back research and work that had to be done before deciding to go with this platform. But it sounds like within 6 months it was up and running and functional. And again, it sounds like all those operational pieces of who will get a message, who won't get a message, who's going to have permissions to do it, whatever, you know, how are all those pieces being mapped. So a lot of that kind of work. But
so for us, it was more management-wise, who heads of departments who really should have access to this, like front desk staff or don't have access to it. We filter everything. So if they say, well, this person said they didn't receive a message, can you look into it? Then we'll look into it. But yeah, I mean, it's been great. We haven't really had much of no. Yeah. The only thing is that we're still every once in a while troubleshooting with nurses or like MAs, and and things like that. Because in our system, we can actually edit an appointment. So let's say you're supposed to see, Dr. Nick at 10 o'clock and he's gonna run late, he's running late, and I go in, I edit the appointment and change it to 11 o'clock. Unfortunately, the patient won't receive that message. We have to cancel the appointment and reschedule it. So trying to change that culture with certain staff members it's been a challenge for some that are just used to just, why can't I just edit it? That's 3 clicks less, but it's very important to cancel the full appointment so they can get not only the cancellation of that appointment but the new one. So that's still a little challenge here and there.
But that is also sometimes it affects, certain patients take it in a different way. Someone, let's say, as Carmen was saying, you have an appointment at 10 o'clock with Dr. Nick, but Dr. Nick is out today, so the other doctor will see you. So if you cancel and then reschedule for even for the same time, you get a cancellation and then you get another scheduling notice. So some folks may get a little confused, rather than, for lack of a better word. But that's something that we're looking into. Like in that case, we don't want to cancel altogether and reschedule, but we want to use a feature that pretty much just edits, hopefully, the appointment, so that we eliminate that message, the double message going.
I agree. It's like you just
It's a
cancel
mixed
my
message.
appointment, then you just book another, and then you just cancel, so they get a little bit confused. We used to do that behind the scenes, but now they know everything that we're doing. Yes, yeah.
I mean, mainly for the appointments that are canceled and rescheduled, there is some outreach done. Of course, like I'll call the patient and say, he's gonna see you at 10:15 instead of 10, so they know automatically that that's going on.
Yeah, sometimes says, yes, I know, I already got the message. But we just wanna make sure that if they have any questions or, that we outreach to them, letting them know that we have made some changes to the appointments.
Oh, another thing that helps is if a provider is out, one thing that we can do, in the morning, I have staff that comes in with me around 7:45 in the morning. We go ahead, we get the email notification, unfortunately this provider is gonna be out. We can go ahead right then and there and start canceling the appointments. And then I would have staff kind of reach out to the patients, but automatically they already know, my appointment's already canceled, and by the time we call them, they're already aware of what's happening and why we're calling. So that's something that we benefit from.
I came in a little late, so apologies if you touched on this, but are you collecting written consent before the patient gets their first text message?
So the consent that we have, the consent that we have is just the regular ones that we have, consent to bill and treat, communication, we have all that at the beginning of an registration. Yeah, registration.
So it's, the regular consent's not specific.
Is that because you can opt in versus,
You can
because
opt
you're
out.
asking and you ask if you want this and you can opt in or opt out? Is that part of the?
Yeah, that happens at registration with the consents for treatment and for communication. Most of the time they don't read it.
Do you have CareMessage listed there specifically?
No,
It's just part of the general communication.
Yeah, because most of the time they don't read it, they get the form, they sign it, and they give it to us, but it is our responsibility to let them know that we will communicate with them.
And when you do your welcome CareMessage, does it say you can opt out? I mean, they sort of assumes that, but I just wanted to sort of say that out loud, that you could opt out at that moment.
Correct.
Before you get the more personal.
And you actually will see the red circles. You can like run a report of all the patients that don't have. And you can make in a red circle, and then you have to figure out how to communicate with them. But they will be receiving any messages.
Any other operational, I have 2 quick ones, but other operational, workflow specific? So wrapping up this sort of section for a moment, and this is a 2-parter, operationalizing things are always hard, and everybody does it differently, as you example here. What would you say are the 2 most important pieces that you feel, that you must do as a health center around training the staff? And then I'm gonna ask you the same thing around sort of training, if you will, or discussing this with patients. So what are the 2 most important take-homes you would say? If someone here was gonna push go tomorrow and start training staff, what you'd be like, oh, you must do this and that?
One thing that my staff benefit from, and this is just overall, is a live showing of it, of how, which, you know, CareMessage helps you with that, but just to have that available for the staff. Visually, they react better to it than just something on a piece of paper, not only for front-end staff, but for providers as well.
That's great.
And I think data is very important. So you have to, everything you present, you really have to back it up to show that it is beneficial. And these are at least results that have happened in other areas where this product or this technology was used.
It's some excitement, buy-in.
Some providers did have questions before as to the no-show rate. We had a podiatrist provider who unfortunately had a few no-shows, and he was questioning if we really did outreach to patients or not, or did we drop the ball. But we were able to go into CareMessage, run the report, and say actually 7 out of your 15 patients did say they were coming, or X amount didn't respond. But that's available data for providers or for anyone that needs it.
So what would you say are the two most important take-homes around training staff?
Yeah, I agree, visuals and how, because the way it happened to me was like dramatic.
Yeah.
Right, because it was like, oh, you're there, now you have not left, come on, let's do it. So I am proud to say that I was able to overcome that challenge, but if I will train staff, and also I'll be the coach, you know, I don't know everything, but I know I can go to CareMessage if I have a question. We have now every other week rather than every week because it comes so fast. And also because I've been very careful of what type of messages I'm sending, so no overwhelm the patients and so much information at once. You know, getting them used to it, receive the feedback, and then maybe I can add something else and something else until I actually feel comfortable myself. So I will say definitely visual, have the opportunity to play. I know there is, how do you call it?
The dummy system.
Yes.
So we played around with the dummy system for a little while until we got used to it.
Right, so you can do that.
You can swap back and forth.
Right, and play with it, so, and they have somebody there that's kind of the coach. And also for more than one person to know how to do it, because if that person leaves, then you don't know how to continue with the message. So, you know, delegate and have the heads of each department know how to use it. So if they have a project that they would like to send a message, so they know how to do it. So as I said, because that's what I was doing, the what they did. That was true.
Yes.
I had a question sort of from the operations perspective. So you start care messaging, maybe Lynn can answer this, and you have 41,000 lives touching this through the care message. Do you know at the end of like a year how many people are consistently engaging and responding yes and no and canceling the appointments?
We're able to run a report. We haven't done so yet. We just started back in January, I think it was, January, February, around there. So we haven't run that data yet, but we are able to report on, like I said earlier, CareMessage sends us a weekly report of who did not respond or they weren't able to get through to them. So we're kind of tackling that a little bit as we go, but overall, we don't have a number.
Can I just ask, do you still do manual reminder calls for anyone like who opts out of CareMessage, or are you doing any manual reminder calls at all?
For those that opt out at the moment, no. I know for behavioral health they still do that. For medical at the moment, no.
What is your reminder policy for folks who, that's a great question, aren't in CareMessage?
At the moment, if they have my chart, they get through my chart.
Okay.
If not, there's some people that just don't want.
They just don't get it at all.
So to that, what you said, did a little project at a time, the team,
teaspoon.
I'm stealing that.
Yeah, me too.
When you find you want to make a change or an addition on the next project, how user-friendly is the system?
It's pretty useful. It's pretty easy. The challenge is to get my reports from the source. So, you know, sometimes we have to rely on other departments to get the information that you need, and sometimes partner with the IT department so they can give me the files to be able to upload it to CareMessage. Sometimes that makes up because it has to be on an Excel file. So we used to get a lot of PDFs, and now we are requesting that everything is converted in Excel because CareMessage has to be used to the Excel, and that becomes sometimes a little
Well, once you
challenging.
get the Excel though, by putting
Then that is pretty easy. You save it and then you upload it and then you choose your verbiage and then you get in there and then you click send and it's gone. So once you know how to do it, it might take, and you have everything, it might take 5 to 10 minutes, just to review, making sure that that's the message you want to send. It's, 10 minutes, I would say. Not even. But for me, it's 10 minutes. Yeah.
So it kind of, it caps you off at a certain amount of text, so you just have to make sure that you gather the information that you want in that.
And even if you're enrolling different groups or different programs, once.
It's endless.
Yeah, you name your group.
Yeah.
So like for example, it can be October out, so my next one will be October outreach, and that's my group.
We're doing one for flu clinic, so we're gonna be open every Saturday for the next 2 Saturdays, so we're gonna do some outreach through CareMessage for flu clinic, and then we're gonna be open.
So my apologies, we were going over time. Whoever booked it in my calendar said 11, so I thought it was till 11, so my apologies for that. Real quickly, Blair, do you want to sort of just talk about CareMessage for a moment, and then we'll wrap up?
Sure. Well, Vinny, if you want to have any closing remarks. The one thing I was going to add, I think in just like, so I work with community health centers in Massachusetts and talk with health leaders every day. One of the things I wish we talked more about is sort of along the lines of what Vinny was talking about with language and precision of language. I was talking with Rebecca before this all started about the wording in social determinants survey screening that they did, and they asked, do you need help with housing? They received tons of people saying yes, even though they didn't have that immediate need, but it was the wording that they were like, sure, yeah, I'd love to not pay as much as I'm paying now to get support. And it's the same thing we find for text messaging is being really conscious of how a message is received by a patient is as important as the technology that underlies getting it out. And that's what we really want to encourage the conversation to shift towards is keeping things at or below a 6th grade reading level, making sure that it's very straightforward and culturally relevant. I'm happy to chat with anybody. I know we're over time about CareMessage if you'd like, or just patient engagement in general. But that's sort of my thing that I wanted to highlight. Yeah.
And we have this room if folks want to stay and chat. But I want to first of all give you guys a round of applause. It was not easy. Thank you. It's been incredibly helpful and informative in lots of ways. And thank you all for coming. Really appreciate it. And if folks want to stay for a few moments and eat more food and talk amongst yourselves, you're more than welcome. Thank you so much. Thank you, CareMessage.